So our next population is going to be about those who are overweight or obese based on the criteria. So again, overweight is defined as a BMI 25, between 25 and 30, and then obesity 30 or greater. So some basic stats, about 70% of adults are classified as overweight or obese, with about 42% being strictly obese, and then 7% with severe obesity. And even in children, it's relatively prevalent. About 32% of children are considered overweight or obese. Uh, Problem with this is overweight and obesity are linked to numerous negative consequences: cardiovascular disease, diabetes mellitus, some forms of cancer, and then other issues as well. And obviously, it's a very expensive condition. There's a big burden on the healthcare field. So just a review of BMI. So you can see the ranges here: overweight 25 to 29.9, obesity 30 and above with the different categories, and calculate BMI by weight divided by height squared. And BMI and risk. Um, this is the classic J-shaped curve that exists between BMI and health risk. So you can see that there's a sweet spot around BMI in the low 20s up to about 25, where the disease risk and mortality risk is the lowest. As BMI gets higher after that, it just continues to go up. And then also at the very, very low ranges, where people who are have very, very low body weight relative to their height, the risk also goes up. And that is mainly accountable for people with conditions such as anorexia, eating disorders, and then various wasting diseases, like different types of cancer. So recommendations for those who are overweight and or obese, you can see it's overall not that different, but as you can imagine, caloric expenditure is going to be key here. So frequency is going to be on the upper end, at least 5 times a week. If necessary, start on the lower end of intensity, move up to the higher ends as they progress. Duration, it says 30 minutes, but also consider this should be a weekly goal here. So at least 250 to 300 minutes per week of physical activity. So however you can get that done. Resistance training is recommended, not as the only form of exercise, but as an adjunct to aerobic exercise. And then flexibility, as you see here, very similar to what we saw for other populations. So things to consider: ideally, start small, move big. Caloric expenditure is key, progressing to at least 250 to 300 minutes per week, and that would be about 2,000 kcals a week of activity. Frequency, as we said, on the upper end. And then, if necessary, you can accumulate short bouts to reach those goals. Another thing to consider with especially in those who are obese, is minimizing orthopedic stress, whether that's you engaging in non-weight bearing activity such as cycling or water-based activity that can minimize orthopedic stress. Walking is fine in most cases. Jogging or running might be an issue just due to the repetitive high impact that's going to be occurring in someone who's already at a high body weight. Resistance training alone doesn't really help that much. So as I mentioned earlier, it should be an adjunct to aerobic exercise in this population because caloric expenditure is key. And then some of the benefits of resistance training can enhance muscular strength and physical function just like it can for anyone else. And then also you do get the other benefits of resistance training, like when we were talking about resistance training as an important component for diabetics. A lot of obese people are at risk of diabetes as well. So it's definitely something to consider. It just shouldn't be the only form of exercise. As far as reducing body weight, 3 to 10% is recommended over 3 to 6 months. And what that looks like is to target about 1 to 2 pounds a week and trying to get a negative caloric balance of about 500 to 1,000 kcals a day is a good goal, and that can be targeted in a couple of ways. You can obviously increase energy expenditure by exercising more, but also reducing the energy intake, so reducing the number of calories that are taken into the body. So moving on, we're going to touch on exercise recommendations for those who are pregnant. So in general, pregnant women without any contraindications to exercise are highly encouraged to exercise throughout the pregnancy. Some of the health benefits: preventing excessive weight gain during pregnancy, although obviously they're going to gain some; reducing the risk of gestational diabetes, which is diabetes that just occurs during pregnancy; decreased risk of preeclampsia, which involves hypertension in pregnant women, and also urinary incontinence; mood, quality of life issues. Low back pain is common in women who are pregnant, so exercise can target that. Has been shown to reduce the length of labor, which is great, and then also just maintaining and improving fitness levels. So after the woman gives birth, they'll progress quicker and kind of get back to their previous fitness level if it dropped any during pregnancy. So to determine if a woman is a good candidate for exercise while they're pregnant, there's this screening questionnaire which asks some basic questions, and it's very similar to the PARQ. So if you answer no to all these questions, then it's pretty safe. It's a safe bet that they can engage in exercise without any major complications. If they answer yes to any of these questions, so they should answer no to all these questions, ideally. If they answer yes to any of these questions, it just refers them to their healthcare provider to get clearance to exercise while they're pregnant. And this is just a continuation of that. And you can read more of these details if you like, but that's the gist of it. If they answer yes to any of those questions, they need medical clearance. So some of the physiological responses of the body that change during pregnancy are listed here. So overall, responses to acute exercise: VO2 is going to be higher, more oxygen consumption is required, heart rate is going to be higher, stroke volume higher, cardiac output higher due to increased blood volume. Tidal volume is usually going to go up. Ventilation, all these things are going to increase. Notice the only thing that doesn't, though, is blood pressure. So blood pressure should not really be affected that much due to pregnancy by itself. As far as recommendations, generally speaking, they're not going to be that different than a healthy individual. There are some special things that we need to consider, though. You may have to make modifications based on some of the symptoms they're feeling during the pregnancy. And then, again, there's a lot of evidence to show that exercise is very beneficial during the pregnancy period. So these are the guidelines as you see it. Not overly different than what we see for healthy adults. So 150 minutes a week. Moderate is generally recommended. Talk test is commonly recommended, and I'll discuss that in a second. Other than that, modality is very similar. May need recumbent exercises in some cases, cycling. But if the individual can do it safely and effectively and they don't have any issues, it's generally going to be okay. Resistance training can be engaged in also. But overall, these recommendations right here are going to be primarily focused on aerobic exercise. Even those who weren't exercising before pregnancy began, it's okay to start during pregnancy, but again, starting at a low intensity and gradually progressing really slowly is important. In the past, it was recommended if women weren't exercising before they got pregnant to not start during pregnancy, but now it is. It's just you have to be really careful. Start at a low intensity and gradually progress from there. As far as intensity goes, a lot of times in pregnancy they do recommend the talk test. So in other words, a woman should be able to maintain a conversation while they're exercising, and if you can't, the intensity is thought to be a little too high. So that's a general guideline for most individuals. Um, and then potentially, if they're exercising at a higher intensity or doing a lot of exercise, caloric intake would likely need to go up a little bit just to account for that. So in general, during pregnancy, caloric intake goes up anyway, but if you're doing intense exercise, it would just go up a little bit more. These are reasons to stop exercising in those who are pregnant. So you can see a list here. Any of these present, stop exercising and see a medical provider. So as far as types of exercise, you can see the basic stuff here: walking, swimming, cycling, aerobics, running. All that's fine if the person can tolerate it well without any issues. Um, as I mentioned earlier, resistance training is fine during pregnancy. Uh, but again, just being extra careful with it, starting on the lower end and progressing up. Some other types of exercise that are could be important here is pelvic floor exercises, like Kegel exercises that can help with urinary incontinence that sometimes happens during pregnancy. Right, and then a few more things. Collision sports or contact sports generally not recommended during exercise. Uh, any exercise that presents a risk of falling, something like rock climbing, anything like that, could be potentially be an issue. Jumping quick changes in direction, that could put extra stress on the body. Scuba diving, anything in the heat, like hot yoga, hot Pilates, those are generally frowned upon due to the temperature regulation issues. Reducing the Valsalva maneuver or not doing the Valsalva maneuver. The Valsalva maneuver could impact blood flow to the fetus, which could be a problem. And something common in women also during pregnancy is diastasis recti, where you get a splitting of the abdominal muscle. And a lot of times that can be targeted in physical therapy, but you can be really, really careful about it. And a lot of times after pregnancy, women can go through a program to help kind of heal that, where the abdominal muscle kind of splits. As far as supine exercise, traditionally supine exercises have been frowned upon in women who are pregnant, but now a lot of the research is saying that some might be okay. So it all comes down to whether or not the individual can do this without any issues. So if they can do a supine exercise and not have any physical, musculoskeletal, or other symptoms that are occurring, it probably is okay. But again, it's one of those things just to be really careful about. Other things, heat, which I mentioned before, could be an issue. So avoid exercise in hot environments, hydrate well, and then exercising indoors if it's really hot outside for hydration, water before, during, and after. Low back pain. Uh, so if that's an issue, you modifying the exercise program. So again, maybe recumbent type exercises or water-based exercises may be appropriate. And again, as far as energy intake, uh, pregnant women, the metabolic demand is going to be increased a little bit. So increase in caloric intake as well is important. It doesn't necessarily need to double, but just there will be an increased caloric cost during the pregnancy period. And high altitudes over about 6,000 feet have been could be potentially problematic. And then, so that generally speaking, unless you're living at a high altitude, it's probably not a great idea to go to a high altitude and exercise during pregnancy. Then after pregnancy, what's known as postpartum exercise, working with a healthcare provider to determine when and what type of physical activity can be resumed. Uh, and then when starting back after pregnancy, just gradually progressing again, starting on the lower end and progressing up. And then some of the big benefits of postpartum exercise: enhanced recovery after giving birth, helping with weight reduction after giving birth, and also helping with some of the depressive symptoms that sometimes occur after a woman gives birth. And there's no evidence that exercise interferes with breastfeeding as long as enough energy is intaken into the body. All right, the last population I'm going to target here are older adults. So, older adults, it's kind of broadly defined as those over 65 years or older. Uh, there is this little caveat in there: if someone's 50 or older but has really significant conditions, they could also be classified kind of under the umbrella of older adults. And then another thing to think about, this little last bullet point that I have up here: health and functional status are better indicators of ability than chronological age. So it kind of just drives home the point that some people who are older are completely healthy, completely fine, where others are not. So you may have a 45-year-old who looks really, really old or has a lot of features of older adults, or even 50-year-old, whereas you might have a 60 or 65-year-old who seems physically a lot younger. So there's a big spectrum of things that can go on in different people just based on the lifestyle they've lived over their life. So this aging curve, just kind of showing your functional capacity, our ability to do stuff as we get older. So growing gets better and better and better. During adulthood, it generally hits its peak in young adulthood, and then later in life, as you get into middle age and then older age, functional capacity tends to drop. So our goal here is just to kind of flatten that curve a little bit, so you don't have to have that big drop and go into what they would call a disability, beyond the disability threshold. So there's an overwhelming amount of evidence that exercise is beneficial in older adults. So some of the benefits are listed here: reducing risk of chronic disease, increasing longevity, psychological benefits, body composition benefits, and then just slowing really that physiologic aging process. So these are just showing the effect of aging on some of these variables, and things to think about, like maximum heart rate is going to be lower. We know that just looking at the max heart rate equations. Cardiac output is going to be lower. Blood pressure is generally going to be higher. VO2 max is going to be lower. Your fitness level comes down as you get older. Pulmonary issues, the residual volume is going to be higher. That's the amount of air left in the lungs after you exhale. Vital capacity lower. Muscular strength lower, flexibility lower. See, all these things tend to go down, body fat up. So you get all these kind of negative consequences as you get older. So one of the goals of exercise is to prevent that or reduce the magnitude of the drop or increase in some of these things. Just some basic stats. 16% of individuals 65 years and above engage in regular aerobic and muscle strengthening activities. So that's not very much, 16%. And then when you get to 85 years of age, only 7% or less are physically active, engaging in aerobic and muscular strengthening activities. So classic exercise testing may not be a great idea in this population if there's no other reason for it. So just to get their VO2 max, generally not recommended unless you're screening for disease or something. So what they do recommend, though, are some physical performance testing. Or then I'll show you a few of these on the upcoming slides. But these are little functional tests that older adults can do just to get an idea of what their functional capacity is. And also force development is important. So a lot of times when we think of power, we think of young athletes, but power is really important in older adults as well, to help maintain their physical function. So here's some of those physical performance tests I was talking about. So a lot of these are batteries of tests where they do multiple things and get a score. So there's a senior fitness test. There's a short physical performance battery. You can just measure gait speed. There's the 6-minute walk test that you've seen before. And then there's other continuous scale of physical performance tests. So there's a variety of tests like this, or batteries of tests that can be done in older adults to give you a really good idea of what they're capable of. As far as the prescription continues, age obviously should not be a barrier. Uh, there's going to be a really low aerobic capacity, low muscular strength in older adults, so you have to keep that in mind. Again, starting on the lower end, progressing up. And then all areas should be targeted: aerobic, muscular strength, flexibility. And in older adults, we also want to think about things like balance training and other neuromotor exercises that help with their everyday activities. And then as far as intensity for older adults, RPE is always a safe bet. So using the 10-point scale in this case, they're saying about 5, 6 on that scale for moderate intensity, 7 and above for vigorous. So a lot of older adults aren't interested in monitoring their heart rate or anything complicated. So just something as simple as an RPE would be appropriate in most cases. So here's the recommendations for older adults. You can see the frequency for aerobic on the upper end. Again, it really depends on the person. Intensity, you're seeing that RPE that we discussed. And other than that, it's very similar goals to what we saw for healthy adults. Modality, adjusted for older adults. So it may include aquatic exercises, recumbent exercises. Resistance training, definitely recommended. Starting on the lower end, progressing up. RPE is a fine way to measure intensity for resistance training as well, or if applicable, you could use a percentage of 1 RM. And then just, again, start on the lower end, moving and progressing from there. Stretching, flexibility recommendations, very similar to what we saw for healthy adults as well. So regarding fall prevention, neuromotor exercises, anything that's going to tax the ability of the individual to maintain their balance, or agility drills, standing on one foot, eyes closed, that type of thing. Any type of proprioceptive training has been shown to be really effective in preventing falls and just helping overall quality of life. And then some recommendations regarding this. So gradually progressing into different postures. Maybe have a progression from standing on 2 legs to tandem to then one-legged stance at the end, progressing towards that. Eyes closed would also play a role. Any dynamic movement that makes them kind of maintain their center of gravity, like walking and turning, and then stressing a lot of the muscles that are involved in posture, just like standing on the heels, standing on the toes. Then a lot of older adults enjoyed classes, so like Tai Chi is thought to be really, really important for neuromuscular coordination. All right, a few more final things. Again, start low intensity at the beginning, progress up from there. And progression should be individualized, just meaning that just because some older adults can progress more rapidly, not everybody needs to. Some are not going to progress much at all. Some will be very similar to younger individuals and be able to do a lot more. And then as far as resistance training, very important for older adults. So muscular strength starts to decline, especially after about age 50. And then regarding resistance training, any type of resistance training is generally fine, but keep in mind, if an older adult is not familiar with it, you may want to focus on some basic stuff using machines as opposed to free weights, although free weights are totally fine if they can do it safely. And then initial training sessions supervised, so to make sure that they can safely and effectively do the exercise before they're turned loose on their own. Power training, again, if possible. Any quick movements are going to be beneficial to older adults as well, to help maintain some of their muscular power as they get older. And sarcopenia is common with older adults. So again, it's underscoring the importance of maintaining muscular strength and resistance training. And cognitive issues are also important. So again, as people get older, if they have any cognitive issues, may need assistance during the exercise session. And then some basic other things, like cool down, really important in older adults to prevent any lack of blood flow to the upper body.